So hello friends, welcome to my new video. So today in this video I'm going to discuss with you all about a very important topic that we all should know, that is vision therapy in amblyopic patient. Okay, so from this video you will get to know what is amblyopia, what is the physiology behind amblyopia, and what is vision therapy, why to give vision therapy, why not patching therapy, and what are different types of vision therapy that is available. Okay, so let's start. So we will start with amblyopia. So amblyopia is a vision development disorder where one eye fails to achieve its normal visual acuity even after giving full refractive correction with eyeglasses or contact lenses, or even after doing the surgical procedure, the eye visual acuity is not improving. That is called as amblyopia. Okay, so as we are discussing about vision therapy, I would like to say that for a successful vision therapy there should be a equal participation or active participation of the doctor, vision therapist, patient, and the parents of the patient. Then only vision therapy will be successful. Okay, otherwise it will be not successful. Okay, so if we go to the physiology behind amblyopia, then let's take a case where a child is having congenital cataract in his left eye and came to the hospital at 4 years of age. It means that he is living with cataract since 4 years. So 4 year he was having impairment of vision in his left eye. Suppose the cataract is in left eye. Okay, so this left eye will get less light stimulation than the right eye, which is normal. Okay, so what will happen is that this left eye which is having cataract will form a bad image, and the right eye which is a normal eye will form a good image. Okay, so if this condition lead to a prolonged period of time, so at that situation what is happening is that a term is coming, that is ocular dominancy. Okay, so in ocular dominancy what is happening is that as the left eye is unable to produce or unable to give a proper clear image, so the brain prefers the right eye image, that is a good image, and ignore the image formed by the left eye which is having cataract. Okay, so this ignorance, if this continues for a long period of time, then it leads to amblyopia, and then it leads to suppression. So why amblyopia? Because the left eye is unable to form a properly formed clear image. So that what is happening is that due to less light stimulation in this left eye, the neurons which are taking responsibility to transfer the light stimulation to the visual cortex are also getting shrinked, so that the left eye is not working properly due to lack of light stimulation. So the opposite eye, and that is the right eye, will get fixating eye or dominant eye, and this will produce a good image. So the person will have difficulty in 3D vision or stereopsis also. So that is amblyopia. Okay, so uh, so in this picture, by seeing this picture and having a little discussion on amblyopia, if we discuss about the management procedure, the first thing that that comes in our mind, that is the patching therapy. So patching therapy is still, or till now, patching therapy is considered as the gold standard treatment for amblyopia, and it is performed in many amblyopic patients since more than 250 years. So patching therapy has a very long history, and it is also seen in many research articles that patching therapy is giving some improvement of visual acuity. Okay, but why I'm discussing about vision therapy now, as patching therapy is having these benefits. So in a certain points, patching therapy has some limitation, where patching therapy is not properly workable. Okay, so at that situations we need something else, something more improved technique than patching therapy. Okay, so what is the limitations of patching therapy? Let's discuss. So patching therapy have limitations like recurrence of amblyopia is more in patching therapy. So why this recurrence of amblyopia is more? So patching therapy, where what is happening in patching therapy is that a patch is placed over the fixating or normal eye and force the amblyopic eye to see. before patching therapy, if the amblyopia is due to any obstruction, like if due to presence of any cataract, then first of all surgery of that surgical removal of that cataract should be done, and IOL placement also be done, and after that give the patching therapy. So after the surgical option and correcting the eye with best corrected optical correction, then patching therapy will start. Okay, so the patch is placed over the normal eye and force the amblyopic eye to see. Okay, so if this patching therapy is long continued, then it is seen that the visual improvement is there. Yes, I also agree. But if this patching therapy is stopped after 1 year or half year, then what is happening is that the amblyopia that is reduced is again reactive, and the patient visual acuity again get dropped. Okay, so that is known as recurrence of amblyopia. Okay, why? Because the patching therapy is the treatment, monocular treatment, not a binocular treatment, so that there is no role for fusion and stereopsis. Only visual acuity improvement is the main aim of patching therapy. So this is why in many cases the recurrence of amblyopia is seen when the patching therapy is stopped. Okay, another thing is that poor compliance. Why? Because in this picture you can easily see that the child is wearing a patch over his right eye. Okay, that means his right eye is the fixating eye and left eye is the amblyopic eye. So why poor compliance? Because the patch which is placed over the eye, many children have allergic reaction to that patch and irritation also, and there is very various types of social stigmas also working. Like suppose the child is a school going children or nursery or student. Okay, so when he go to school or nursery classes, then the rest of the classes student are not wearing any patch, and he is the only student that is wearing the patch. So he is feeling some shameful thing that no, I'm different from others, why, and I should remove this patch to look normal like this. So this type of social stigma and burden is coming over the child, and he don't want to wear. So yes, there is several types of cartoon droid patches are available, as well as spider like, but children don't want to wear those patches as it looks it make them different from others. And another is that poor binocular vision. As I already discussed you, that patching therapy is given monocularly, not binocularly. Okay, so after treatment there is poor binocular vision is there definitely, and when it take longer time, that means the patching therapy take longer time to improve the visual acuity. Like in many cases it is seen that it is taking 1 year or 1.5 years to improve the visual acuity. So if this patching therapy is very long continued, then the parents of the patients also get frustrated, and they don't want to continue the patch to their children. Okay, and most important limitation is the patching therapy is only given to those children who are age less than 10 years, because there is coming the critical age of the child where it is called as the plasticity of those neurons. Okay, so plasticity of first order, second or third order neurons are up to 10 years. So patching therapy will work or be effective if it is given before 10 years, and it also take longer period of time to improve the visual acuity, as well as the full compliance are there. So there is various types of limitations are available. So if the child, or if any adult who is having age 15 years, so 20 years, 25 years, having amblyopia like anisometropic amblyopia, then patching therapy will not work in those patients. So what to do in those patients? So for that purpose we need to think something beyond patching therapy. So that is the improved version, the improved treatment or management technique than patching therapy, and that should be there should be no compliance, poor compliance is there, and that management should be effective, as well as less compliance should also be there for a successful treatment. So there here coming the vision therapy. Okay, so what is vision therapy? So vision therapy is like a physical therapy of the visual system to improve the visual system. Okay, so what is the visual system? So visual system actually including proper functioning of the two eye, normal visual pathway, normal visual cortex, good coordination between eye and the brain, and also most importantly there should be normal functioning neurons. Okay, So that is known as vision therapy. So as I already told in the starting of this presentation, that there should be active participation of the doctor and the optometrist who is giving the patient vision therapy, and the patient, there should be an active participation, and good motivation should be given to the patient and the parents of the patient to continue the vision therapy at home also. Okay, so what are the advantages of vision therapy? So first of all, it gives the training in both eyes, so binocularity is maintained. Then excellent compliance from the patients is there, because vision therapy is not having any limitation, only benefits are there. Okay, and it is seen that in many articles it is seen that vision therapy gives faster improvement than patching therapy, and effective in older populations also. So we can give vision therapy to children's as well as adults, and restoration of binocular vision is more than 90%. Why? Because in vision therapy both eyes are involving in that management. Okay, not only one eye is including. Okay, vision therapy, two eyes are working together, and along with that the amblyopic eye also getting improved vision. Okay, and so binocular vision is established and no recurrence of amblyopia is seen. Why? Because in vision therapy, first of all, the vision therapist will give anti-suppression treatment, and along with that anti-suppression treatment, fusion and stereopsis exercise also given to the patient. So this makes the improvement of the visual acuity stable position, and there is no deterioration of the visual acuity seen. Okay, so you can see this picture. So here the child is wearing the red green glasses or red green filters in front of her eye, and watching this heart chart which is having red and green strips. Okay, so here this is called as the flipper, where red and green filters are there. Okay, so the child will see the red strips with the red filter and green strips with the green filter, and there are some alphabets are written, and the child is asked to read the alphabet. So the child will not see the red strips with the green filter and green strips with the red filter. So it means that child should or have to use the red filter eye to read the red striped letters, and green filter eye to read the green striped letters. So she need to use her both eye. That is called as monocular fixation in binocular field, where two separate images are given to both eye, but the background is same for the both eye. That is called as MFBF. Okay, so here this thing is done, and here both eyes are participating to read it, and if one eye is more dominant than the other, and child is using one eye and not using the other eye, then she cannot read what is written in this heart chart. Okay, so here also the child is wearing a red green glasses, and there is several types of softwares available that can convert any movie to dioptic. So I will discuss dioptic in the later slide. Okay, so here also you can see that this game is normally looking like this, but for the treatment purpose for an amblyopic patient, this game is converted to this. So this is also we can call as a MFBF, but it is we can call as a dioptic treatment. Okay, so what is dioptic treatment or dioptic therapy? So dioptic therapy is a contrast adjustment therapy, where good contrast image is given to the amblyopic eye, and less contrast image is given to the fixating or normal eye, so that the amblyopic eye is forced to see what is going on, and the fixating eye is normally working, because the contrast is also only varying, but the visual acuity of these two images or two letters are same. So here in this game you can see that there is two colors, that is red and blue are there. So in this software there is an option to control the contrast, like the controller can reduce the contrast of this red color and increase the contrast of this blue color. So it is depending on the patient, that what eye is having amblyopia, that will be given a good contrast image, and which eye is having a normal or dominant eye, that will be given a less contrast image, and the child will need give to play this type of games, and so that child should use their both eyes to play this type of game, and if the child prefer one eye than the other, then the child cannot proceed in this type of games. Okay, so these games are very much addictive and they can play easily. So this is it known as dichoptic treatment, where you can see there is two separate images are there. So these images contrast can be changed. Okay, so suppose the person or the patient is having amblyopia in his right eye, and left eye is the fixating eye. So this left eye contrast will be decreased, like 20% contrast is set in this picture, and here 100% contrast is there, so that his amblyopic eye will try to see, and his fixating eye is normally working, but is working with along with the amblyopic eye, so that binocularity is maintaining as well as the amblyopic eye is also working. So to continue this dichoptic treatment, this virtual reality box should be wear in the patient eyes. Okay, so this is another type of dichoptic therapy, where it is a game. Okay, it is a space game where you can see there is a spaceship is there, and there is some objects are there. Okay, so suppose the patient having a right eye fixating eye and left eye is the amblyopic eye. So right eye is seeing only the spaceship, and left eye is seeing these coming objects. Okay, so right eye is the fixating eye seeing the spaceship. Okay, so to proceed in this game, the patient need to use his both eye, so that the game will be continued. But suppose the patient is not using the left eye and continues to use his right eye, then he cannot proceed in this game, because some part of the game is seen by the fixating eye and some part of the game is seen by the amblyopic eye. So these are the dichoptic therapy that is getting more popularity and also giving much improved result than the patching therapy. Okay, so another thing is that stereo blocks. Here you can see there is two colors are there, that is red color and blue color. So in this setting area you can adjust the contrast of these two colors, like suppose the patient is having amblyopia in his right eye, and left eye the patient is fixating eye. So right eye is having the red filter, and fixating eye is having or left eye is having the blue filter. So reduce the contrast of this blue and increase the contrast of the red. So his amblyopic eye will work more to see this object, and his fixating eye will see this blue, because with the blue filter he will see the blue color only, but he will see the red color as black, and with his amblyopic eye he will see only the red, he will not see the blue. So the patient need to use his both eye to play this game, otherwise he cannot play this game. Okay, so this is another type of game where red and green color are there. So here also in calibration deviation you can easily control the contrast of these two shapes, and after giving the patient the red green goggles, and instruct the patient to make this triangle inside in this green triangle. Okay, and depending on at what eye the child is having, or the adult patient who is where he is having amblyopia, select the filter selection, and after that give the patient this type of game. And also you can prescribe this type of game to the patient to play in his home also, where the prescription will be like 1 hour per day, or 5 days per week, or 6 weeks. Okay, 6 weeks. So this is the training duration that you can prescribe to the patient to practice in their home, and also consult with the parents of the patient, so that they can also cooperate more to improve or to continue the vision therapy to the child, so that the child can improve his visual acuity more. Okay, so this is another thing. This is known as monocular fixation in binocular field. So here you cannot control the contrast of the image. So this is called as MFBF. So here it is in between the patching therapy and dichoptic therapy. It is not a dichoptic therapy. Okay, so here you can see that with the red filter, red strips letters are seen, and with the green filter, green strips letters are seen. But with the red filter, green strips appearing as black, and here with the green filter, red strips appearing as black. So the patient need to use both eyes to read what is written there, otherwise he cannot read it. Okay, so this is the home based exercises that you can give to the child. And so many people think that these vision therapies are very much expensive. So not like this. Vision therapy is very affordable. You just need a red green goggles, and then you can give your child a red and green crayons, and after wearing the red green glasses, just instruct your child to draw something. Or there is many types of many games are available in the Play Store that I showed, these type of stereo blocks, or this type of embryo games. Here ball and dogs are there, or here you can see the several types of games available, breaker game like this. So there is several types of variety of games. Also there is most popular game in embryopic therapy is digress in iPad gaming. So these games are very much attractive, and also the childs do not feel any type of boringness to play this type of games. So just wear the child a red green glasses, and give adjust the contrast at what eye you need to set up, what amount of contrast you are giving, and after that give the child to play this type of games, so that by playing the games like 1 hour per day or 5 days per week, he is you will observe that the visual acuity of that embryopic eye will increase, okay, or improve. Okay, so along with that dichoptic therapy, there will be a fusion exercise and stereopsis exercise will also be given, where Brock-String exercises or Brock-String method also be given to the child, so that his fusion and stereopsis also should improve. Okay, so this all depend on the vision therapies, that what he prescribing and what is the duration, and at what time period the review to clinic is advised. Okay, so these all depend on that optometrist who is treating the child who is having amblyopia. Okay, so these are the review of literature that I did in support of my presentation, where all these literature are saying that this vision therapy is giving more improved result than the patching therapy, or similar to patching therapy. So if we see that this vision therapy is giving similar result like patching therapy, and we also discussed some limitations of patching therapy, and vision therapy is not having any limitation, so why not we give only vision therapy to the patient and avoid patching therapy, so that the improvement of the visual acuity as well as fusion and stereopsis will also be there, and there will not be any limitation. So this is how we can easily improve the visual acuity of the child. Okay, so that's all friends, thanks for watching, and please don't forget to like my video and subscribe to my channel, and please don't forget to hit the bell icon so that you will get notification whenever I upload a new video. And if you are having any question, then please comment in the comment section so that I can answer your questions. Okay, thank you so much.